course of my career, I have seen many changes in the way we practice dental hygiene. One of the greatest advances is the routine implementation of ultrasonic scaling. As a 1980s graduate of dental hygiene school, it took me a long time to embrace the idea of regular use of ultrasonics. We were taught it was only for gross scaling, for heavy calculus, and the only way to effectively scale and replane teeth was with hand instrumentation. The tips were large and the units were not easily accessible. Fortunately, through advances in science, technology, and design, we now know about the many advantages of ultrasonic instrumentation. The ultrasonic tips are able to disrupt the bacterial biofilm more effectively than hand scaling. The tips are now available in different shapes, and we are able to access areas subgingivally with less tissue trauma. Some units even have a separate chamber to use medicaments, such as chlorhexidine, as an irrigant during scaling procedures. In addition to the disruption of the biofilm, my patients benefit from my use of ultrasonics because they spend less time in the chair listening to the sound of the calculus and stain being removed. They love how quickly they can feel the difference as the calculus is removed from their teeth, especially in the lower anterior areas. There is less trauma to the tissue and tooth structure and less pressure applied to their jaw. As hygienists, we no longer just clean teeth. Our roles include blood pressure screenings, obtaining detailed medical histories, intraoral and extraoral photos, periodontal chartings, nutritional counseling, risk assessments, etc. All of this with little or no extra time in our schedules. The additional time I gain by the use of ultrasonic instrumentation along with hand scaling gives me the opportunity to perform those procedures on my patients. It also reduces the strain on my hands so I can continue to practice dental hygiene for many more years.